This is Scott Becker with the Becker Private Equity and Business Podcast. We come to you today with short business episodes, concise private equity episodes, interviews with business and private equity leaders, often brilliant leaders like the one we have on today, also sometimes irreverent daily life type episodes. We're joined today by Holly Buckley. Holly lives at the intersection of private equity and healthcare. She also leads the McGuireWoods Healthcare Department, which is one of the largest nationally recognized departments in the country. We're going to talk today about leadership and deal trends. Holly, let me tee it up and ask you. You've now been running the national department for a few years. You've done a remarkable job in talent, in people, in growing the department. Talk a little bit about lessons in leadership. Any thoughts that you would have for others on leadership, advice to leaders? When you think about leadership, what is front and center for you?
Thanks, Scott. And as always, thanks for the conversation today. I think for me, the biggest thing is really just communication. Well, in terms of people, and we're in a people industry, it's just really direct communication and open lines of communication. I think it's critically important to talk to your people, no matter the level, from the most junior to the most senior, and tell them what's on your mind, what your expectations are, and make sure they can come to you with what's on their mind. And so I think we've talked about this a lot before, just being in the people business, people are the assets, is critically important to be able to communicate well. I think in terms of other topics, I think one of the things I've been thinking about a lot recently is strategy. And I think when things are really busy or you're really wrapped up in particular projects, it's hard to take a step back and focus on strategy. And for me, being 3 years into leadership of the department, but also kind of being at this mid-year point, I'm now stopping and saying, I need to take a pause and a step back and re-strategize. And I think for me, at least, sometimes that gets lost. I'll admit it. And I think it's good to pull back and remind yourself of that and set aside the actual time to do the very deliberate kind of goal setting and reflection. And it's important to have the quiet headspace to do that. It's something that you can't do kind of in between other tasks. So I think that they're the two things that I'm focused on right now, one being communication and the other being feeling the need to take a step back and re-strategize and make sure I'm on track with the things I want to do.
No, thank you very much. And it's setting the time aside for strategy and thinking about, what is the target client, the target work that we're trying to do, the target people we're trying to have, and then constantly or regularly resetting towards those cores. Because often the strategy doesn't change that much over time, but sometimes there's decent sized pivots where if we've been traditionally hardcore in the representing private equity funds that invest in healthcare businesses versus life sciences businesses, even though the firm itself does a lot of life sciences, you think sometimes, do we need a bit of a pivot to do both? We've also over time.
Well, that's right. Yeah.
Go.
Yeah, and it's not just the work that I'm chasing, but it's also people and growth. And so as we look at the group and we think about where do we want to be in 5 or 10 years, it's both what work are we individually chasing and what work collectively as a group are we chasing, but what additional people and resources do we need to do that, and how do we want to spend our time there? As you know, the kind of lateral recruiting game is very hard and time consuming. And so you only have a finite amount of time to do it. And so where do we want to really focus, both geographically and subject matter wise, to be who we want to be as a group in 5 or 10 years?
Thank you. And talk about, and over the years, we really evolved into a practice at McGuireWoods in healthcare. Private equity funds invest in healthcare, both providers and services related to it, and large health systems. And then, of course, some of those sponsored companies, large healthcare growth companies. Talk a little bit about trends that you're watching in healthcare today or in private equity today. I know deal environment seems to be picking up. It was up year over year, but still down from years past. What are you sort of watching out there in terms of deal trends and the business trends in private equity?
Yeah, so I think there's still a tremendous interest in healthcare, but the focus of that interest by investors has pivoted from direct provider investment to the businesses that surround that, as well as other areas such as pharma services and life sciences. And so we see more interest in businesses like staffing and healthcare IT and kind of the businesses that help healthcare providers operate more efficiently. And then as I said, kind of the pharma services, life sciences, kind of the other side of healthcare as I think of it. And so there was a PitchBook report that came out, I think just very recently, it was maybe this week or last week, kind of looking at these trends and saying that, overall private equity providers make up less than 4% of the US healthcare provider market. An investment in this area, the growth has really, really slowed, but there's still a significant interest in investing in kind of some of these other areas. And so that's what we're watching as a group. And there's always going to be a huge amount of work to do with healthcare providers, because healthcare providers are still a massive, still throw off a massive amount of work, but it's not necessarily going to be in private equity investment in healthcare providers, but there's always going to be work to do with healthcare providers. So we continue to look at those for-profit and non-profit platforms and hospitals and health systems, as well as now these other companies that are really getting a lot more interest to support those providers.
Thank you. What about the health IT area? What do you sort of seeing in the health IT and digital health area? What do you see there?
Yeah, and that kind of a lot of that goes into the bucket of kind of that I mentioned, kind of the companies that exist to support the healthcare provider system. And so we're seeing a lot of investment in healthcare IT companies, whether it's revenue cycle management or telemedicine platforms or value-based care platforms. There's a lot going on there, even just kind of very basic, mundane functions that need support through digital health solutions. And so that's where we're seeing a lot of private equity funds focusing their time and attention.
Thank you. No, fascinating. And pharma and medical devices seems relatively busy. Any thoughts there, what you're seeing there? I know the firm is busy there. The industries are busy there, more into pharma services and pharma. PitchBook just said, they're starting to cover pharma services more heavily as that becomes one of their hottest growth area. Any thoughts around those areas too?
Yeah, we're definitely seeing a lot of interest and activity there. So it's kind of the clinical trials, contract manufacturing, and kind of that whole space, not the actual life science pharmaceutical company representation, but pharma services being the companies that support the pharmaceutical industry. And so we've been seeing a lot of growth in this for probably the last, I'd say 24 months, maybe a little bit longer. But that's definitely an area that funds are trying to get smart in. We're seeing a lot more investment bankers getting smart in this area. And it started really with clinical trials, and now we're seeing more of kind of the other flavors there. And we're certainly investing in that space as well so that we can support our fund clients and others in the industry as they're looking to be more active, both on the investment side and kind of the ongoing work that comes from that.
Thank you very, very much. Again, Holly Buckley joins us today on the Becker Private Equity and Business Podcast. Is sort of a magnificent leader and great insight into the sort of breadth of healthcare and pharma and life sciences work. Holly, thank you for taking the time to visit with us today on the Becker Private Equity Podcast. It's always great to visit with you. Just fantastic. Thank you.
Thank you.